Receiving a cancer diagnosis and the treatment that follows can be all-consuming, and all of it can affect various parts of your body. So today we explore the link between the brain and the pelvic floor when undergoing cancer treatments on today's All Things Brain Health. Good morning, I'm Alexis Del-Cid. I'm so happy that we're doing this topic today. Welcome to All Things Brain Health. When you hear pelvic floor therapy, you may associate it with therapy for new moms or women going through menopause, but the reality is so much wider. Pelvic floor therapy can help with all sorts of things: bladder control, bowel movements, sexual health, pain, and here's how it connects with the brain. Pelvic floor therapy begins with the brain's ability to retrain and heal, and undergoing cancer treatments can disrupt that connection. Breast cancer survivor and pelvic floor therapy patient Susan Lufchek is here with us this morning. Thank you so much for being here. We also have pediatrician Dr. Pam Shaw, who's right next to me. Dr. Pam Shaw also underwent pelvic floor therapy, not for cancer, but for all sorts of other things. And we have our two pelvic floor therapists. Both have doctorates in physical therapy. We have Dr. Eileen Kokenauer and Tricia McCulloch, and they are both here to enlighten us. They helped start the Pelvic Floor Clinic here at the health system back in 2017. So I want to start with Dr. McCulloch, because Dr. McCulloch, how does your brain play a role in pelvic floor function?
So a lot of people aren't exactly aware that they have a pelvic floor, but when we come into therapy and we're actually asking people to focus on it, the brain itself receives information from those muscles and goes to the brain, and the brain sends information back down. So we develop better awareness, we learn to actually control the muscles and help our overall symptoms.
Super interesting. So Dr. Kokenauer, what major organs are affected and supported by the pelvic floor?
The pelvic floor is sitting at the bottom of the pelvis. So it is supporting the reproductive organs, the bowel, the bladder, but it also serves functions for sexuality, stability of the pelvis and hips and the torso.
You brought two models, so feel free to allude to those when you're talking about. So the female model.
So we have the bones of the pelvis itself, and then these are the pelvic floor muscles. So on this model, we have the urethra, vagina, and anus. So these are the pelvic floor muscles, and so you can picture everything above it is what's supported, but really the pelvic floor impacts our entire body.
It's like a bowl holding all your valuables. And then for the male model.
So it's similar. We have all of the same musculature for the most part, and again, it covers this entire region and supports all of their internal organs as well. There are some select differences between male and female pelvises. Like you can see, this one is a lot more narrow compared to female pelvis because these ones need to be able to pass babies through them.
Okay. And then when you talk about the connection with the brain, how is pelvic floor therapy retraining your brain? I want to ask both of you that question. I'll start with you.
Yeah, so we encourage patients all the time to utilize imagery strategies and really isolate these regions in their head so that they can better learn how to feel different things. We have different imagery strategies we use to really light those centers up in the brain. We might have other exercises that we kind of do to help people get a sense of, okay, I'm kind of feeling what they're talking about, and we have a lot of different tools to help with that as well.
So how does that conversation start with your patients?
It is clearly very person dependent, but it usually starts with, let's try to just feel the muscles themselves. So when you're contracting and releasing them, just doing that helps retrain that connection from the brain to the pelvic floor. And then trying to use those pelvic floor muscles throughout the day with exercise, use them as part of your functional kind of engage your core type of statement would be using the pelvic floor along with that.
And we're going to get to our patients in a minute because they both have very different stories. I have one more question. I want to break down Dr. McCulloch, the kind of problems you see in patients that are specifically going through cancer treatments?
So it can be really dependent on the type of cancer and really more so the treatment that they undergo. The more invasive the treatments, likely the more potential for more side effects and quality of life challenges. So we do see a lot of bowel and bladder changes. They might also experience pelvic pain, and again, like you mentioned earlier, developing some sexual dysfunction.
And is that the same for men and women?
It
who
absolutely
go through
can
cancer
be.
treatments?
Absolutely. Yeah.
Susan, I'll start with you. Your breast cancer treatment kind of skyrocketed you into menopause. Is that correct? And that's
Absolutely.
what started.
Absolutely.
Sounds like fun. So what was the treatment, and when did you start to notice, I've got a problem down there?
Well, so my treatment was I had a bilateral mastectomy and radiation, and then I did not do chemo, but instead I had a medicine monthly that suppressed my ovaries.
Okay.
And so by that medicine, 1 month I was not in menopause, and the next month I was.
Oh my gosh.
It was that quick.
So no warning to anyone.
There was no warning, no nothing.
Oh my gosh.
It was, yeah, just going to the other side.
And so what were the effects on your pelvic floor or in your reproductive area specifically that you were noticing?
Well, so my breast cancer was estrogen positive and progesterone positive. And so I can't take any supplements or anything because I can't have that in my body. Since my cancer thrived on it, right? So I just noticed a lot of dryness, and that was just very uncomfortable to me.
Of course. And then Dr. Shaw has said we can call her Pam for the purpose of this show, but she is a doctor. She's a pediatrician. Dr. Shaw, you didn't have cancer, but you did undergo pelvic floor therapy for painful intercourse, urinary incontinence. At what age did you discover pelvic floor therapy was an option?
Yesterday, no.
But you're a doctor, and you were saying you didn't know it existed.
That is exactly right. Well, I'm a pediatrician, so not many of my patients, if they get physical therapy, it's usually something having to do with their extremities or their back. So this was totally new to me. I actually had my routine colonoscopy done. And the gastroenterologist, bless her heart, said to me, you know, I think you would benefit from pelvic floor therapy. I had 3 babies, all of them 9-pound babies. Oh. And so, yeah,
nice.
Vaginally.
Oh, man.
That was really a bad idea. But I love my children, and I'm glad I had them.
Glad you're here. You didn't come in
you're
the
here.
easiest way.
But yeah, that's lifelong complications to that.
Right.
So when I first saw Eileen, the first thing that she asked me was questions about my bowel habits and intercourse, and as well as my bladder function. And I thought, what kind of thing is this? And she was so thorough with her history, and I really recognized at the time this was something I should have done years ago. I thought that just because I had been through menopause, that this was the way things were going to be, and thought I just had to suffer with the consequences of this. So it was such a relief to actually find out that just like the physical therapy on my shoulder, I could get physical therapy on my pelvic floor and help with the pain and all of the side effects that were associated with it.
Dr. Kokenauer, what's that first conversation like? You have a good sense of humor about it, which is why I'm sure so many patients are comfortable with you.
So we talk about bowel, bladder, pelvic pain, pain with intercourse. Those are kind of the generic starting points. In the bowl.
Yeah.
So and a lot of it is led by whatever the patient's comfortable with. So most of them kind of know a little bit of what they're coming into and kind of to expect. And that first appointment could look anything like just a full conversation. We might talk lifestyle stuff. So if they're having a lot of bowel issues, we need to talk what food they're eating and what fluids they're taking in. If they're having pain with intercourse, then we're talking vaginal moisturizers or other components that go along with their sexual intimacy. Also pointing out that they may need a mental health therapist to help with that too. Depending on the patient, there is an option of doing a hands-on internal assessment, maybe some orthopedic assessment on that first day, but it is very much based on what the patient is comfortable with, what they're needing, and that's kind of the theme for the whole thing, is really meet the patient where they are, meet them with what they're ready for, and that's going to look very different per person. These two women clearly are open and willing to be part of it and kind of share, so that's why they got invited, and I have others who appropriately would not be comfortable at all having these conversations.
As we were talking about before the show started, I said just pretend like we're talking about pelvic floor therapy at brunch. And I said, that's weird. And Dr. Shaw, Dr. Kokenauer and Dr. McCulloch said, it shouldn't be weird, right? We talk about our back pain, our knee pain, our shoulder pain. It's a physical therapy. We need to just talk openly about it. Dr. Kokenauer, can you just show us on the model, when it comes to the actual physical manipulations, what areas are you pressing on to help certain issues? Oh, I'm sorry, Dr. McCulloch. I'm sorry.
You're totally fine. So, again, it's going to be strongly dependent on what we find with our assessments. We commonly do a lot of work around the vaginal opening for people who are dealing with maybe some more anterior issues.
So you're pressing on the muscles.
Yes, but it's not hard.
Right.
So how I describe it is pressing firmly enough like you're trying to test the ripeness of a tomato. Any harder, you're going to squish it. We don't want to do that. So it is gentle, and if people are very clearly in a lot of discomfort, we're not just going to keep poking and prodding at things. We are going to stop, because that's already given us enough information. And I know we are kind of pointing at these external muscles here, but I am going to break this apart real quick. You can see on the inside, so this is just one side, all of the red that you see here, this is all musculature. So it goes quite deep into the pelvis, and we're going to be exploring, trying to determine exactly where their dysfunctions are per their comfort level.
And that can help just like any other physical therapy.
Absolutely.
When we talk about the brain connection and how it's working, Pam, how did that work for you? What did the brain retraining look like?
It was really interesting to me because Eileen gave me some ideas. I was getting up every 2 hours to go to the bathroom at night, and she very rightly told me, you know, you're not old enough to have to get up 3 times in the night. You should get up once.
No one should get up.
Yeah, well, no one. Yeah, if
that
possible, that'd
terrible.
be, it was. I wasn't getting good sleep.
No.
I wasn't feeling good because of all of that. But we talked about imagining how the capacity of my bladder and really retraining my brain to not necessarily get up every 2 hours, and it's been a lifesaver. I'm still just getting up once at night, Eileen.
That's so great.
It made such a difference in just how I felt to start with. And then we talked about some of the incontinence I was having as well, and I was wearing a mini pad to all the time, and it was
no fun.
It's embarrassing. It's awful. And again, retraining your brain to understand the connection between your brain and your bladder, that how important that is, and using those muscles to control it. So instead of going home and running to the bathroom, I would feed the dogs, I would look at the mail, then I would go to the bathroom. So really retraining myself and my brain to understand my body and the need when I needed to go to the bathroom. So a lot of it was her being very patient with me and telling me, you can do this. I know you can do this. And really having her support in learning some breathing exercises and really just getting in touch with, you can be better.
Do you feel like it was the physical component of the therapy, or it was the brain retraining that helped most?
It was a combination of both, but I think the brain part of it.
So interesting.
I mean, and we know this as physicians, the brain is so powerful. It can cause pain. It can cause distress. It can do so many things, and it has control of all of your organs. So the idea that retraining your brain to actually do healthy things for you, that this is part of what you can do, is a really, really big thought for most people. It was for me.
Susan, what about you? Did you feel more benefit from the physical manipulation of the muscles or the retraining your brain?
I would have to say both. And Dr. Shaw, you're putting it way more eloquently than I could, so thank you. But I had the same thing with, the urgency of urination and whatnot. And Eileen has taught me various tricks. One of them, and I'm going to share it, is wiggling your toes. Which,
oh, interesting.
Exactly, because you wouldn't think that that would have anything to do with it, but it does. It does help. But I've also, Eileen has helped me figure out what my triggers are as well. And I love my Diet Pepsi. I probably shouldn't say name brands, but I love my Diet Pepsi.
Right.
And, that kind of caffeine. And so that's a trigger for me. So taking it out of my diet is something that really helps me.
Were you warned about the possibility or educated about the possibility of needing pelvic floor therapy before you went through your cancer treatment?
I was not, but it is impossible for the doctors to warn you about every possible thing that you may need. I mean, treatment is customized for each individual person, and it's amazing. It's just amazing to me that every cancer is different. There's no two cancers the same. There's no two treatments the same. And it's amazing to me. So I was lucky because I had gone to my oncologist and told her about my symptoms, and then she recommended pelvic floor therapy, and she referred me to Eileen.
Tricia, when patients come to you, how many of them say they didn't know this was an option, or they'd never heard of it until 2 weeks before they were referred to you?
I would say that it's a high percentage over the years that I've been doing this. A lot of people have no idea, and it's part of why we've worked with the medical school, with students going through school, to get them in and shadow. We encourage people to come down to the clinic and spend some time with us so we can kind of change that knowledge and understanding one person at a time. And then things like this can help people to understand we can help, we exist, and like you did, bring up your symptoms. We want to help.
Dr. Kokenauer, how did you decide to specialize in this? You went to physical therapy school, and I can tell you when I had pelvic floor therapy 15 years ago, the doctor I was talking to said, yeah, you're lucky you got in. I don't know of any others in Kansas City, which was wild to me. Well, one, I'd never heard of it. Two, I couldn't believe she was really the only one who knew of herself. She said, there's very few of us because no one talks about this. How did you decide to specialize in it?
So I was actually doing oncology-based lymphedema. So I was doing lymphedema treatment only for patients with cancer. And then actually Tricia moved in across the hall from me at our clinic, and the patients walked out and said, you've made my life so much better. You've changed my life. And I said, what is she? I want part of that. I want to change people's lives.
Right.
I still laugh that the most entertaining moment was the woman came in and she was like, I had intercourse and it was good. And I was so excited. And I was like, I did not know I could be this clinically excited.
That's a superpower. That's a good doctor.
Without paying.
Yes. Yes.
So yes, she was a huge influence on this, and now we have 6 therapists. There's 20 within the KU Health System.
That's so great.
Yeah.
That is so
wonderful.
great. We have some great questions coming in and some comments. So if you have a question or a comment you'd like us to read during the show, please send it to us on YouTube or Facebook. We have the links on how you can connect with us in real time right here on your screen. Now, we touched on this a little bit at the beginning of the program. Both of our guests today are women, but pelvic floor dysfunction affects men as well. When you talk to your male patients, and Dr. McCulloch, I'm going to start with you here. And it's hard. I'm vacillating between doctors and first names because everyone is so familiar, which I'm sure adds to the comfort of your patient. So excuse me if I go first name and slip into that. When the men come to you, how do you soften them up, and what are they like when they come to you? Are they resistant?
So this is very person dependent. Some of them might have some reservations and not really understand why they were sent to PT. Others are, I asked to be here. So I'm always excited to hear when people have requested physical therapy. And I don't really treat anybody any differently. I'm asking the same questions. I'm trying to figure out what's going on with their symptoms, how it's impacting their quality of life. And I literally saw a gentleman for the first time yesterday, and he goes, you just make me so comfortable. Thank you so much. This is going to be so much easier because of how comfortable you're making me. It's like wonderful, because this is what we want. I want people to be comfortable coming into the clinic.
Are they typically cancer patients that come to you?
We see a lot of cancer patients, but we also, I worked with a young man who was a very heavyweight power lifter, and
Right.
he was having some testicular pain. So we are seeing the whole range of pre-op, post-op, all genders. Our clinic does not see pediatrics, but there are pediatric therapists
That's
all the way
interesting.
till essentially end of life when they're, if they're having pelvic pain and they want some relief. Cancer treatment can be painful.
Yes.
And so we've done essentially palliative care for some nearly end of life patients as well.
Everybody deserves to be pain-free.
Yes.
We've got some questions I want to get to, and Teresa has a great question. She wants to know, are Kegels the same thing as pelvic floor exercise? Dr. McCulloch, I'll go to you.
So the Kegel is what we wind up calling a pelvic floor contraction. I would say it's common that when people are saying they're doing Kegels or pelvic floor exercises, that might be what they're talking about. But technically, when we do other exercises like bridges and more core type of work where you're working on the abs, the pelvic floor is kind of working in the background as well. So it can get a little confusing. I know in our clinic, we're very specific on what we call it, pelvic floor contraction. I do still call it a Kegel because it's a lot quicker to say, but and easier to type in the documentation too. But it can be a little bit confusing if people are just going online and trying to look up, what is pelvic floor exercise? Most of the time you're going to see people probably doing a bridge exercise.
A bridge?
Yes.
And the bridge would...
So they're laying down on their back, knees bent, feet
like
on the
in
ground,
yoga.
and they're lifting their bottom in the air.
And that's a pelvic floor exercise?
It does work the pelvic floor. I use it, it works a whole lot of different muscles. I strongly use it for the glutes and the buttock muscles.
Okay. Jeremy Yenser has a great question. He writes, I've heard of pelvic floor stuff, but it was always in the context of correcting an issue after a lot of time of being miserable. Are there things worth knowing or doing while everything seems normal before you have issues down there?
Within reason, yes. We can look at it kind of from a preventative standpoint. They're muscles like any other muscle in our body. We want them and need them to be doing what they should be doing, working in conjunction with all their other muscle groups, learning what is quote unquote normal for bowel and bladder function. And even just knowing that you can come in early. So maybe you're like, oh, I'm starting to notice some changes that maybe I don't love. Come in then rather than waiting until you've been enduring this symptom for however long.
Okay. Lisa has a question. She wants to know what happens during the examination. And Dr. Kokenauer, you did talk about that a little bit. But I would like to know, when people come in for the exam, are they in just a specific private room? Do you have dividers? Obviously they're alone with the patient, but how does that work?
Yeah, we each have our own private treatment room. So you're in a kind of like you would picture like a typical physician exam room. It's about that size. So we have our mat, chair, computer, just kind of a nice comfortable environment. We are talking, and then again, depending on the person, on what we get to from a hands-on physical assessment.
Sally wants to know, what are you pressing on or doing to make sex less painful? Physically, what does that therapy look like? And feel free to use the models.
Yeah, so this is going to, again, be dependent on what's going on. As you stated earlier with your treatments for cancer, things started feeling really dry and uncomfortable. And so with the vaginal canal itself, it's that if that's the route we're taking, you do have to push through those tissues to then get to the muscles underneath. And this is again why we're also quite gentle with our techniques. We're not aggressive, because those tissues might have been impacted by cancer treatment or menopause, and it can be a combination of trying to
show us.
Yeah, so
I think people are
this
just
will
curious
actually
how it works.
This is not to scale. So we'll say that right now. Definitely
for that
not to scale.
clarification. Yeah.
So we would be for vaginal. Hang on, I can't see what's happening here.
You're doing a great job because everything's reversed and you're holding it up to the camera. Okay.
There we go. Okay, so we have the vaginal canal here. Okay, so we have muscles that surround that opening, and there are multiple layers. So if we are inserting a digit or maybe some type of tool like a dilator or a wand to help with the extensibility of the tissues, we'll press through the vaginal wall to then get to some of these muscles. So it becomes a combination of both. We're helping with, here we got
So you're
muscles
trying to reach those
all
muscles
through here. Yes, and it just depends on where we find that tightness. We're not going to necessarily, manipulate it if the muscle itself feels fine.
Sure. I mean, and the only way to reach those muscles, there's no other way, there would be no other way to do that.
Correct.
You can do a little bit externally, but as I kind of tell a lot of patients, if you're comfortable with it, if we can do internal assessment and work, that's kind of really where the bread and butter lies.
Marge has a comment. She writes, "It's so refreshing to finally hear women talking about this. This was not an option when I was younger." I see you nodding your head. I mean, you're all nodding your heads. Dr. Shaw, Pam, as a doctor, how frustrating is it to know that something that is so helpful to so many women is something that's still not known or talked about as widely as other things?
I think it's probably one of the most frustrating things that I dealt with during my process of working in physical therapy, because I really feel like that more people need to know about it. When Eileen asked me if I would do this, I said, yeah, I'll do it, because it's part of your body. And understanding your body and being able to do everything you used to do, and you can't, when you get to a certain age, you can't do everything you used to do, but you should be able to do the things that you enjoy. And so the first time that I was able to have intercourse without pain, I was that person who came to her office.
Like where angels were singing,
yes.
and you're like, oh.
And my husband was also singing.
He's probably
too.
delighted, right?
Because he knows it was painful to me to do this. So it was really like, this is the way it should be. I
Yes.
mean, menopause doesn't mean you stop doing the things you enjoy. It should be you continue to do the things you enjoy and enjoy them even more, because you don't have to worry about going to the rest of it, like getting pregnant or anything like
Right,
that.
exactly. That's a good way to think about it. I do have a quick question for Tricia, because Eileen mentioned she was inspired by you, and all these patients were coming out and they looked so happy. What inspired you to get into pelvic floor therapy?
Ooh, so without getting too detailed, I have suffered from pelvic pain for a very long time. It's something that kind of gradually developed over many years, and when going to my doctor, they could never physically find anything wrong. And it was doctor after doctor after doctor, and I even had one tell me, if we can't find anything physically wrong with you, we're gonna send you to mental health.
Oh my gosh.
And so burst into tears and was like, okay, I know I'm not crazy. Fast forward, I get into PT school and they start talking about women's health, and I was like, wait, hold the phone. What are we talking about here? And I learned all about the pelvic floor, and I took a hard right turn in my trajectory and was like, this is what I'm gonna do with my life. I'm gonna help myself, and I'm gonna help other people like me.
That is, what a gift, and thank God that you ladies are doing this, because it's changing lives. I would love to keep talking about this topic because it's so necessary. We do need to get to today's takeaways. So Dr. Shaw, I'm going to start with you. What would you say to women or men watching that are reluctant because they feel shy?
I understand because it is a very personal thing, but I would hearken back to the fact that it's your body and you should be able to control it. And a lot of this is in your brain, but a lot of this, I mean, especially with the physical therapy that I went through, it was so empowering to know that I could do the exercises Eileen taught me at home, and continue to do the things that I like to do. And I also learned a lot about my pelvic floor.
Which we should know about. Susan, you went through cancer treatments. First of all, how are you feeling physically?
Oh, I'm feeling great. I'm the strongest I've ever been. I'm a 5-year cancer survivor.
Oh, that's incredible. Yay!
Yeah, absolutely. And yeah, I'm feeling strong. I do so many things that help my pelvic floor every day now that I know I'm engaging it, thanks to Eileen. And Eileen had recommended Pilates and yoga and strength training and all of that so many people, do, but might not be doing it correctly because they're not engaging their pelvic floor, correctly. And Eileen taught me that I'm probably not even breathing right.
Really?
Yes, she just taught me that. And so I've been practicing that all week.
What's the proper breathing look like?
When you breathe in, you're supposed to expand breathe in the air, right? So it expands your muscles. And then when you breathe out, you contract. And so many people, do it the opposite way.
Oh. I'll have to.
So you're going to practice it later too, I bet.
Yes, ma'am, I will. You talked a lot about, as we were talking to you before this program aired, the emotional support and how important that is. And I know that was really important to you.
Oh, it absolutely was. And
you shared some beautiful images with us. So
I did. Those. So it's so funny. Support is huge for cancer patients and cancer survivors. And so I actually joined a Dragon Boat team, so I'm going to give a shout out to the KC Pink Warriors.
That's awesome.
And just being around that group of women, there's over 50 of us. But it's funny because that support actually was a result of me getting my dog. So I got my dog at the tail end of treatment, and then my dog led me to my good friend who just was shown Brandy, and she and I met through a mutual friend who wanted like my dog. And so she's the one who we went through treatments together. We supported each other. We talked on the phone a lot. And then she joined the Pink Warriors, and so I joined a year later. And it's just been a phenomenal group. And we can have these discussions because we're all, women, and we all support each other and bring up issues, and it's just a great group and competitive too. So,
and men should have these conversations too. Yeah, they need to know about this. It could help them. It could help their partner or anyone. Dr. Kokenauer, what's something that you want viewers to take away from this?
It's never too early and it's never too late. Just come when you are ready to make a change, and we're ready for you.
Dr. McCulloch, what would you like our viewers to take away from this?
So I did state this a little bit earlier, but don't hesitate to bring up your symptoms with your providers. It's absolutely wonderful, especially for cancer patients, that they're making it through their cancer treatments, but you don't have to continue suffering with any side effects of that. We are here to help you thrive.
And if you're not going through cancer, you might be having unpleasant symptoms like Susan, and there's no reason to suffer. There's absolutely no reason. Can you say again how many pelvic floor therapists you have? Because I think it's wild how many that we have.
So we have 20 within the entire KU system, and then there's a lot of independent private practice as well, but 20 within KU.
So just ask for it. Thank you so much, Susan, Dr. Pam Shaw. Thank you for coming on here and joining this conversation, because we need more people to come forward and to just talk about it. It can help all sorts of people who are watching right now. Doctors, thank you for everything that you're doing. And thank you to our viewers for joining the conversation. We will see you right back here tomorrow morning for Open Mics.
When you're diagnosed with cancer, it's not just about the treatment, but the physical and emotional challenges. I'm Jessica Lovell on the next Open Mics with Dr. Stites. Missy's Boutique shows us it's more than medicine. The celebration as patients find style and confidence. Wednesday at 8.